Okay, so I would go ahead and check my PPE and then BSI is mycene safe, yes, mycene is safe. So the mechanism of injury, nature of illness, my patient got ejected from the motor vehicle. And then this is my only patient. Okay, so I would go ahead and request additional ALS assistance, and I would consider full C-spine based on the mechanism of injury. So my general impression of my patient, that my patient is conscious and alert, and has bleeding on the lower left knee. My patient is conscious and responsive. So I would. Is there any life threats? I don't see any life threats present, so I'm good in that department. So after there's no life threats present, I would move on to my ABC. So the airway's open, so there's no vomitus or secretions, and then I would insert adjunct as indicated. I would move down to breathing, so B, and then I would check for lung sounds, and lung sounds are clear. There's no wheezing. After the lung sounds, I would put my patient under high flow oxygen by a non-rebreather, 15 liters per minute. And then there's no injuries that prevent my patient from receiving the high flow oxygen. So I would move down to C, circulation. So I would check for pulse. After checking for pulse, I would assess the skin. The skin is dry, warm, and normal. I would control any major bleeding if there was any major bleeding, and I would initiate the shock treatment. So I would prioritize my patient. So this is a priority patient, and I would take a set of vital signs. So I would check for blood pressure, pulse, and respiratory rate. I would also take a sample history. So any medications that my patient is taking, any pertinent medical history, and any allergies that my patient has, and the last oral intake that my patient had. So after the sample history, after vital signs, and prioritizing my patient, I would go ahead and begin my head to toe, so my secondary assessment. So I would palpate the scalp, and then is there any deformities or any type of injuries in the scalp. I would go ahead and check for pupils, and then is there any bleeding in the ears. I would also check for the nose, and then I would check the airway or the mouth. And then is there any pain here I would assess the facial, the face or facial, and then there's no pain there. I would inspect the chest, is there equal rise and fall, and then I would palpate the chest to see if there's any pain. I would move down to the abdomen. So the abdomen, I would palpate the 4 quadrants. Is there any pain here? Any pain in the abdomen? There's no pain in the abdomen. I would move down to my pelvis. So is my pelvis stable? My pelvis is stable. And then the genitalia, is there any injuries in the genitalia? I would assess any injuries there. I would move down to my lower extremities. So is there any pain here? And then, like I said, my patient has an injury on the left knee, so I would try not to palpate as much there. And then I would move down, and I have pedal pulses. So there's pedal pulses on both sides. I would go down up to the arms. Is there any pain in the arms? As I palpate, is there any pain? There's no pain here. And then I would check for radial pulses. So we have radial pulses. And after that, I would go ahead and assess the neck. The neck, I would check I would palpate for cervical spine, and then for the jugular veins, and I would also check the position of the trachea. So after doing and then I would go to the back of the body, and I would palpate the back. Is there any pain or any pain here? There's no pain. Then I would check for the cervical spine. Is there any deformities in the spine? There's no deformities. And then I would palpate the buttocks for any pain here. So back, so lumbar, thoracic, and then I would palpate the spine, so there's no pain and deformities there. After that, after doing my head to toe and having radial pulses and fetal pulses, I would assess any secondary injuries. So I would control any bleeding. So I would control the bleeding here. Any secondary injuries that I found as I did my head to toe. And based on my patient, so my patient's a priority patient, so I would reassess vital signs every 5 minutes.